Good afternoon and happy Passover to those who will be celebrating that starting this evening. I want to start by talking about a test that was recently authorized by the FDA that detects antibodies created by a person in response to the new coronavirus. This blood test detects antibodies in persons who have been infected, not the actual virus. An important distinction as we are focused on finding COVID-19 positive individuals and isolating them from those who are not infected. Antibody tests will play a critical role in the fight against COVID-19 by helping with identification of people who have actually overcome an infection and have developed the immune response. Results from antibody testing will identify individuals who we assume will be no longer susceptible to the infection and can return to work. This test could also help determine who may donate plasma, being the liquid component of blood, that could serve as a possible treatment for those who are seriously ill from COVID-19. While we are bringing antibody testing to Illinois, our bigger priority right now is obtaining the test that will actually detect the virus. As the governor mentioned in his remarks, IDPH is responding to testing supply constraints by developing multiple testing platforms that will reduce its dependence on commercial manufacturers. We need to know where there are large numbers of cases, hotspots, if you will, so that we can try to do more targeted efforts to stop the spread in those high-risk areas. Today, we are reporting a total of 15,078 cases, including 462 lives lost to COVID-19. That represents an increase of 1,529 cases and 82 lives lost over the last 24 hours. These are our highest numbers to date, and although the numbers are still increasing, I will tell you that the rate at which they're increasing is less, and that is a good sign. We're not seeing the exponential growth that we were seeing before. But even as there may be some glimmers of hope, I say that physical distancing must continue to be the way that we reduce the spread of this virus. Please stay home. I know that there are religious days that are upon us coming throughout this week, including maybe next week and then some others in a few weeks. We still have to stay home. I've gotten multiple requests and protocols talking about ways that people could do church together that they think would be safe. Please, let's stay home. I'm a woman of faith. I miss being at church, Bible study, prayer groups, the laying on of hands. This is not the time. We don't want to hurt the people that we're intending to commune with. Please stay a minimum of 6 feet away from each other. Wear a face mask. Wash your hands frequently. But congregations, church meetings is ill-advised at this time. Find a way to do the services electronically. The testing of our faith produces perseverance, and let perseverance finish its work. We know the strategies that we've employed are working. Let's not stop now. Let's be all in, Illinois. We're going to get to the other side of this pandemic and all be able to celebrate whatever faith we celebrate together soon.